When we're using a spinal extension movement, the spinal extension can either be passive or it can be active. So passive would be where you are producing a movement for your client, and active would be where they are producing the movement themselves. And we can use an extension movement in this prone position, which is sort of middle of the road, in that it is active because the subject is doing it themselves, but they're producing most of the force with their arms. So this is an extension movement, which is known as one of the Mackenzie procedures, one of the Mackenzie techniques. But sometimes there can be a fault with this. So if we just get this subject to perform the exercise and extend the lumbar spine. So if you just press down with your hands. Now when she's doing that, she's able to extend the lumbar spine, but she's lifted her hips up. Perhaps come down again. So we haven't isolated the movement to the lumbar spine. So what we can now do then is hold the hips down. And we can do that in one of two ways. Either you can just use a partner. So I'm pressing down on my subject's sacrum. So just push with your arms again. So now I've restricted that movement to the lumbar spine. Just go back down again. Or we can use a fixation belt. And these fixation belts, Mackenzie belts, are freely available, or you can just use a luggage strap. And essentially what you do is you place that around the lumbar spine. That then clips, or not, as the case may be, onto itself to maintain that. And then I pull that tight. Now making sure that the belt is flat and that the buckle of the belt is away from the subject's flesh. So it's pulling down, and I've sort of attached her to the bench, as it were. So if you just try that movement again. So we're pushing, and you can see, just if you come down again and just do another two of those. So you can see that the pelvis is being fixed to the couch, and the extension movement is occurring above the level of the belt. So that, just rest there. So it's quite a useful exercise, and it can be done at home, you know, if you've got something to fix yourself to. I've known people to sort of lie on an ironing board, which is flat on the ground, and use a belt to fix themselves. If you happen to have a small child, you can get your small child just to sit here, or just your partner pressing down. And it encourages extension of the lumbar spine without extension of the hips.